Well, good afternoon, everyone. Thank you for joining us for this fall 2021 virtual town hall. I'm Dottie Barnes, the Associate Director of News and University Communications, and I'm serving as your moderator today. We have more than 1,100 people listening, and this town hall is being recorded, and we will post it on the Lakers Together website. We've received many submitted questions, and we're going to spend the next hour answering these questions, but also know that you can always email the Virus Action Team with additional questions. And that email is virusactionteam@gvsu.edu. I'd like to introduce our group of panelists today. We have our president, Philomena V. Mantella, Greg Saniel, Vice President for Finance and Administration, and he's Director of the Virus Action Team. Ed Abou-Fadel, Associate Vice President for Academic Affairs, and he's a member of the Virus Action Team. Kate Harmon, Acting Associate Dean of Students and Director of Recreation and Wellness, and a member of the Virus Action Team. Dr. Habiba Hasuna, she's an infectious disease doctor at Spectrum Health and a member of the Virus Action Team. Christy Cooper, Senior Affiliate Faculty in the Kirkhoff College of Nursing. She is also a member of the Virus Action Team. Rence Meredith, Assistant Vice President for Facility Services and Director of the Campus Readiness Team. Michael Coleman, Chief Human Resources Officer. Kyle Boone, Director of Housing and Residence Life. Paul Kramer, Director of Campus Dining, and Doug Lipinski, Deputy Director of Athletics for External Affairs. So let's begin with President Mantella, if you would like to start us off with some opening remarks.
Thank you, Dottie, for serving as moderator, and thank you to all my co-panelists for being here today. Welcome back to the school year. It's been really exciting over the last week to see groups forming, attending college meetings, meeting with RAs, and really starting to see the campus come alive. It's an exciting time. And it's an anxious time, and I realize that. And I want to thank everyone for their patience, for their diligence, for their grace, for their support as we work through this very, very difficult situation that we all hoped was coming to a close as we saw the normal curve begin to go down on COVID-19, and then the variants begin to rise it yet again, and so close to the school year. So all of you have done amazing work at keeping our university focused, keeping our care for students central, and keeping our readiness planning moving. So I want to thank each of you for that. As we've made many decisions, we're going to talk about the most recent decisions in this forum today, but we've made many decisions over the last 18 months. And I want to remind us the three things that we really focus on as we think about all the possibilities. First is community safety, being sure that we're creating an environment where we can ensure that work can be done safely and that people have respect for one another within our community. The second is to keep learning happening. We have seen young people across this country, in our community, and across our university have disruptions in the way they like to learn, in the way they have access to learning, and to the extent that we can avoid disruptions and keeping them moving, even if the conditions are not optimal. That's our second consideration. And the third is we want our Grand Valley family to have the full experience. And to the extent we could provide that, and having met condition 1 and condition 2, that's our aim, that's our objective, that's our passion, and that's the work that we are seeking to do together. In service of this, and not being an infectious disease expert like Dr. Hassan, we have mounted expertise through this vehicle we call the Virus Action Team, and we continue to see new faces today. Some like Vice Provost Abou-Fadel, who has served from the very beginning, monitoring the numbers, making meaning out of it, and some newcomers as we have new challenges to face moving forward. So we've continued to mount our expertise. We continue to follow the science. We continue to work with public health experts, and through that, we continue to forge our own path. This last set of decisions, which people coin as the vaccine mandate, really is broader than that. It has three parts. The mandate is a part of it, and we're going to go into some detail on that, but so is the prevention of masking indoors, as is the continued testing and the way we are getting our campus ready. So with that, I am going to turn to our leader of the Virus Action Team, Vice President Greg Sanyel, to take us through the most recent set of decisions.
Thank you, President Mantella. The communication that went out to the campus community talking about the vaccine requirement, the mask requirement, and the testing requirement, it's important to think of all those as three legs of a stool working together. The vaccine requirement is just one part of it. Masks is another big part of it. And then the weekly testing for those that are unvaccinated until they are vaccinated is a third part. And all of them together working in concert will help us provide the safest campus community that we can for this fall. Now, to reiterate, the vaccine requirement is tied to FDA approval. I think that's been kind of lost in some of the discussions. Everyone's focused on September 30th. Absolutely, September 30th was what was in the announcement, but that's tied to FDA approval. We expect FDA approval by Labor Day. That would give almost 4 weeks after that for people that are not vaccinated that are waiting for FDA approval. And that is a lot of the feedback we have received has been about waiting for that full FDA approval, and we hear you. So that's why the September 30th date, which is after that expected approval from the FDA. If that FDA approval is delayed somehow, we could look to adjust that September 30th date. But more to follow on that, because we fully expect that approval to happen by Labor Day. And also, it's important to keep in mind that FDA approval is coming. It's not going to not happen. It is going to happen at some point. And so for those of you that are not vaccinated, we encourage you to get vaccinated when you're comfortable. If you're comfortable before FDA approval, please do it now. We'll have plenty of opportunities to do that. If you want to wait till after that FDA approval, that's fine also. But again, that FDA approval is going to come. So please, those of you that are not vaccinated, we encourage you to get vaccinated as soon as you can. We received a lot of questions ahead of this town hall. And one of the questions we received, is it legal to require a vaccine mandate? And the answer to that is yes. The Equal Employer Opportunity Commission has approved employers requiring vaccine for their employees. And recently, the U.S. Supreme Court refused to hear an appeal of the Seventh Circuit decision upholding Indiana University's right to require vaccines of its faculty, staff, and students. This signals the court's support of universities taking steps in the interest of public health and safety. Other questions that we had received ahead of this is the exemption process and the timely response. A separate committee, separate from the Virus Action Team, has been set up that will take exception requests from faculty, staff, and students. This exemption committee is comprised of individuals with backgrounds in diversity, inclusion, healthcare, human resources, legal, and religion. And this committee will review applications for people that are requesting both religious exemptions, medical exemptions, and then also postponements. Postponements, an example of a postponement may be a student that won't turn 18 until after September 30th. You say in October or November, they can request a postponement to that time when they turn 18. There's other examples of postponements that are available. This committee is up and running now. They have already issued some exemptions, and they're working through that process now. For those of you that have put in for exemptions, whether religious, medical, or postponement, you should expect a timely response in the next several days. Another question that has come up regards tuition and housing and meal plan refunds if a requested exemption is not approved. I would like to point out that tuition, the fully refundable date for tuition is September 3rd, and that date will hold, and decisions with regard to these exemptions will certainly be done by that date. So yes, if you're expecting an exemption and do not receive it, you will have that answer before the 100% tuition refund date comes. So you can rest assured with that. If that is holding you up, you'll be able to do that. As far as housing and dining, we will prorate that. Again, you know, if you withdraw before coming to campus or using your meal plan, you would get 100% refund for those. People that are not vaccinated will be invited to be tested weekly, and we expect them to do so. Again, it's part of that, getting back to that three-legged stool, in that we have vaccinations, testing for those that are not vaccinated, and masks all working together. And we need all three of them working together. So if you're not vaccinated, we would expect you to get tested. Even if you have an approved exemption to be vaccinated, you still need to get tested weekly. And so with that, I'll turn it over to you, Dottie, unless there are other questions.
Thank you, Greg. That was the bulk of the questions. So many centered around all of the things you just answered. So thank you so much. We had other questions about what if I'm fully online and not having a need to come to campus? How does that work? And also about how masks are tied to our alert levels. So Ed Abufadel, I'll turn it over to you to answer those.
Thanks, Dottie, and I'm happy to be here this afternoon. So on the first question, we've been expanding the form for the exemptions, which includes a postponement section. And Greg already mentioned one in terms of those who are under 18. So another request you can make to postpone the vaccine requirement is if you are a student, a faculty or staff member who is taking courses or working completely remotely, completely online, and will not be coming to campus. So if you go to the form, that's a place you can check off and then give an explanation for it. And the committee that's reviewing the exemptions will look at that. In terms of masks, so our approach to masks going forward is part of a broader structure that we've created. We've actually had a campus-wide alert level system for more than a year now. And this summer, we looked at how that system worked during the first year and decided to do some revisions. It's a system that has, the updated system has 5 levels from 0 to 4. And it's informed by the set of indicators. And I'm going to show you all that in just a moment. So let me share the screen here. We're currently at level 2, which is medium alert. And you can see there's a description of what the alert level is in terms of prevalence of the virus and so on. And then for different key areas of operations for us, there is some language that describes what happens at that level. So you can see offerings on campus, work on campus, face coverings. We've added this to the alert system so that our face covering policy is tied into it. Residential restrictions, dining restrictions, and so on. Up at the 4th level, and this is a web page that I'm showing you here, is very high alert. This is where prevalence is very high, and we basically are going to go all remote. Our ultimate goal, of course, is to get back to level 0, which is near normal. And in that case, there are no restrictions to on-campus work, and face coverings are not required. So we have these alert levels posted on a website. Again, we're at alert level 2. And what informs our decision about the current level are a set of indicators. And you can see some of them here. They focus on different areas, including what is happening on campus as far as how many cases there are per day and our positivity rate, what is happening in the community, particularly in Ottawa and Kent County, in terms of cases and positivity rates. What does the CDC say? They've created a new system to measure community transmission. And where are they on that system? There's also vaccination indicators, and these are really important. Right now, both Kent and Ottawa are at the medium alert level in terms of in that 50 to 65% rate, whereas the Grand Valley community isn't quite up to 50 yet. And as vaccinations improve, driven by our mandate, those percentages will move to the left and we'll move closer to near normal. We also have a couple other indicators, our testing program, how it's functioning, the availability of quarantine isolation rooms, how contact tracing is going, governmental regulations that are affecting our operations, the level of concern in the community, and the incidence of cases at comparable institutions of higher education. There's another page that links to this page that shows what we've identified as the current level for each indicator. And we kind of take all those together and come up with the current level. Finally, we don't move the level quickly. So when we move the level, it's usually at least for a few weeks. And we are starting at level 2. Thank you, Dottie.
Thank you, Ed. I'll repeat that all of this can be found on our Lakers Together website, our GVSU data dashboard with all of that information. Now we'll turn to Dr. Habiba Hasuna. She's an infectious disease doctor at Spectrum Health and has been a member of the virus action team since its start. So we thank her for her counsel and her guidance. And we received a lot of questions, Doctor, about vaccine safety. So if we could begin with that.
Yeah, the COVID vaccines that are authorized in the United States are safe. Those vaccines have been developed with a technology that has been there for decades, and they have passed through all the necessary steps through clinical trials, and they are undergoing the most intensive safety monitoring in the US history that has been done. So far, more than 357 million people received those vaccines in the United States alone without long-term effects have been reported. And mind you that the long-term effects that usually the FDA look into in general is 6 weeks. Even for those vaccines, they put 8 weeks and nothing was noted. They do not affect fertility. They do not have effect during pregnancy, and they do not cause any erectile dysfunction. Now, there has been some rare but serious complications that have been described with those vaccines. One of those is anaphylaxis, which is a severe allergic reaction that can happen with any medicine, any vaccine. And this is usually immediate and can be treated on the spot. And this is why those people are monitored up to 30 minutes after taking that vaccine. The other concern and the rare event that happened was that thrombosis with thrombocytopenia syndrome, which means blood clots with low platelets in women under the age of 50 with the Johnson & Johnson vaccine only. And this is where the recommendation was that those women, if they can take an alternative vaccine, they can go ahead and do that. And even with that, it was a rare event that was found only in women between the age of 18 and 49 with 7 cases per 1 million women, million women. And then the rare one, the last one that you heard about is probably myocarditis and pericarditis, which is inflammation of the heart. But even that is not a contraindication to go ahead and take the vaccine, simply because these cases can happen 6 times more from COVID-19 infection itself rather than COVID-19 vaccine.
Thank you, Dr. Hasuna. We also had many questions about the effectiveness of the vaccine, especially against variants, the Delta variant and new variants that are arising. Can you address that, please?
Yeah, the vaccines that are found in the United States are highly effective in preventing severe infections, death, and hospitalization against different variants, including the Delta variant. Now, while we have seen, and now the vaccines are not 100% effective, right? Just like any vaccine. So while we have been seeing breakthrough infections in people that are vaccinated, with some data saying that they do have the same amount of virus compared to unvaccinated, however, the amount of virus falls faster. So people who are vaccinated, while they can still get the disease, however, they have a milder disease with shorter duration. The way I look at it, the analogy of the seatbelt, I always tell my patients, it might not prevent you from getting into an accident, but it prevents you from getting into a severe one with complications.
Here's another question that came up often. If someone has already had COVID and has antibodies, why should they get the vaccine?
Well, while COVID infection does offer some immunity to the virus, however, this immunity will wane and decline with time. There are reports like anywhere after 3 to 8 months will decrease. The COVID vaccine itself will actually boost that immunity that you got from your natural infection to make it a stronger immunity and more durable one. So you still have to take the vaccine.
And finally, one more, we have some asking that if they're younger or college age, the side effects seem to be minimal. They may have a strong immune system. Why should younger people get the vaccine?
That's a very good question. Younger people need to take the vaccine for a lot of reasons, but for the sake of time, I will just kind of summarize the most important reasons I will say. While young people are less likely to die from the vaccine, however, up until now, we have more than 2,450 young people died from the COVID-19 infection. Moreover, the problem is that young people have what we call the long COVID, are developing long COVID or long haul symptoms. So even after they get a mild infection, they might have persistence of brain fog, chest pain, persistent loss of taste and smell, severe fatigue and shortness of breath that might last even for more than a year on those symptoms. And this can debilitate their life. The other issue that is important, while they have a strong immune system, this can actually backfire because they have a strong immune system. So their body, we have what we call a cytokine storm. So we will have more inflammation that can actually affect their heart, the lung, and end up being in the hospital needing machines to support that. So I know that a nice statement that I read, and it just stuck with me, is that while COVID-19 does not have to kill you to wreck your life. So while like most young people think, well, it's okay if I catch it, I'll be fine. True, most likely you will be fine, but there's also a chance that you might not.
Thank you, Dr. Hasuna. Grand Valley will have several on-campus vaccine clinics that are free and free testing. So to go over this, I'll turn it over to Christy Cooper.
Thank you, Dottie. We will have several free vaccine clinics on both the Allendale and Pew campuses during MoveIn week and during the first week of classes. We'll offer both the Pfizer vaccine, which is a 2-dose series, as well as the Johnson & Johnson 1-dose vaccine. We will hold 2nd-dose vaccine clinics for those people who choose to get the Pfizer vaccine, and those will be on campus as well. You don't have to wait for the on-campus vaccine clinics to get the vaccine. You're welcome to get them in your local community, at your healthcare provider, local health department, and many pharmacies also offer COVID vaccines. For more information, see the Lakers Together website and look under vaccine information. As far as free testing that we have free rapid antigen testing clinics for those who have no symptoms. We do that daily, Monday through Friday at our Allendale clinic, and twice weekly at our Pew campus, downtown Grand Rapids. The Allendale campus also has antigen testing for students or for people who are symptomatic, those people who have COVID symptoms. And that is only by appointment, but that is also Monday through Friday. If someone fails their self-assessment because they have symptoms, they'll be invited to test at the symptomatic clinic and to schedule an appointment. Again, for more information on hours and locations of the different testing sites, you can look on the Lakers Together website under testing and tracing. Finally, for isolation and quarantine, we have a team of nurses who do contact tracing to prevent COVID outbreaks amongst our community. The nurses provide information on isolation for those who test positive for COVID, and also information on quarantine for those who have been exposed. We work very closely with local health departments, as well as other GVSU departments to make sure that housing, health, and nutrition needs are met for our community. For those who are in isolation and quarantine. We have a plethora of educational materials, again, on the Lakers Together website, especially for quarantine and isolation. You can just choose that link there. Thank you, Dottie.
Thank you, Christy. And I'll remind people that also on Lakers Together, thank you. Your team has put together some wonderful flow charts that if you think you've been exposed or may have symptoms or you've tested positive, there are some easy to digest flow charts step by step so you know exactly what to do, who to call, and how to tap into all the supports that Grand Valley has. Well, now we'll turn it over to Michael Coleman to give us an update on human resources supports and any other updates.
Well, we're currently, Human Resources is developing a process of educational programs for individuals who like to know more about the vaccine, COVID, et cetera, as a way of educating you toward and incentivizing you to get the vaccine. That's, in addition, Deb Sanders is meeting with union and the union officials to understand their concerns, and which case myself and Greg will be meeting with some of the groups tonight.
Now we'll turn to Renz Meredith. He can explain the enhanced cleaning procedures and how our campus is ready.
Great, thanks, Dottie, and welcome everyone for joining. My message on behalf of Campus Readiness Team is simple. We're ready for you. We're here. We've done all the right things for the last 18 months on campus with facility services. Staff and facility services have been cleaning and maintaining our campus on a daily basis. We've not let up on any of that process. So we are ready for you. We're probably in a better shape than we've ever been. Sometimes you need a break, probably not the break that we were looking for, but we need a break to catch up on some of the maintenance and household cleaning items. And we've taken care of that. We've done everything we've needed to do. And, the CRT, as we've called it here over the last 6 months or so, was formed in March to kind of get campus ready to go, kind of transition us from what was mostly a remote scenario with online hybrid type classes to a robust fall experience here that we're going to see kick off this Sunday when housing moves in. So classrooms are set. Housing is ready for move-in and everything's clean and ready to go. We've got plenty of PPE that can be requested through our facility services work order system, and we're ready. So welcome back, Lakers, and we're ready to kick this thing off.
Thank you, Renz. You mentioned move-in just a couple of days away, so a nice transition to Kyle Boone with housing for your updates.
If Renz said we're ready, housing says welcome home. We are excited for students to come back on campus. My student leadership team is in training right now to get ready for this experience. My professional staff is absolutely ready and eager and excited. Move-in starts on Sunday, and we will be rocking starting then. So we are excited to welcome you home, and we're prepared in that way. In addition, what can you expect? Great question. Glad you asked. You can expect a lot of programs, a lot of community building that first week. We're really just here to kind of create that space that supports the academic mission of the college and to make you know that you belong here at GV. So we're going to work towards that continuously and consistently. So please be ready for that when you reach campus for move-in. Lastly, it's important for everybody to know that housing is going to follow GV's guidance when it comes to safety. We have rooms identify isolation and quarantine spaces, and we have great partners within housing and the campus that will support our students when they are down and out if they get sick or whatnot. So we're ready for all of these things, and we're hopeful this will be a better year than last, and we are just excited to welcome you all home. And that's housing.
Thank you, Kyle. And Kate Harmon with an update from the Dean of Students office.
Yeah, so just to highlight what Dr. Boone said, we are extremely excited to see everyone arrive on Sunday. I will be there, Dr. Boone, helping move people in. We are looking forward to this academic year, and we encourage students to get involved. The Laker welcome events continue the first 6 weeks of the semester. And we really want to highlight first and second year students, even students that are returning that haven't found their social group yet. These events are for all of you. A few highlights would be our annual Rec Fest, which is hosted by the Department of Recreation and Wellness on August 26th. The Campus Activities Board Laker Kickoff Party on August 27th, and the Office of Student Life Campus Life Night on Sunday, August 29th. Come out, learn about the student organizations on campus and a variety of resources available for students, and get a head start on making connections and building your social group. We also acknowledge the stresses and challenges that students are facing. Students, we invite you to take advantage of resources here at GVSU, like the Wellness Information Team, peer educators, or wellness coaching through Recreation and Wellness, individual and group counseling and educational outreach programs through the University Counseling Center. We have additional supports for your physical health and social wellness through the Replenish Food Pantry, recreational programs and facilities, the Campus Health Center, the Social Justice Centers, and campus interfaith resources. We really encourage you to prioritize your well-being and build healthy habits during your time at GVSU and take advantage of these resources that are available. Students, if you find that you need additional support, we invite you to reach out to your academic advisor, your RA, the Dean of Students office, come give me a call, stop in. Housing and Residence Life, Kyle staff is here to support you. Our student ombuds, alcohol and other drug services, the Office of Student Conduct and Conflict Resolution, or really any faculty or staff member you feel comfortable in reaching out to. We are all ready and we are eager to partner with you on your academic journey. So thank you, and we look forward to seeing you around campus.
Thank you, Kate. Paul Kramer, we're ready for a dining update.
Great, thanks, Dottie. Campus dining is equally excited to be returning to a near normal operations this fall in the coming weeks. We're equally excited to welcome back the Laker community to the campus. Throughout the pandemic and the summer, we've been working on new menus, new limited time offerings, a new catering menu, and the new Laker Club faculty staff lounge is now ready to open, which is just adjacent to the Fresh Food Company. Fresh Food Company will reopen this fall, which is a great addition to have back to our offerings. The Connection and Kleiner Marketplace will also be open. Panda Subway Lobby Shop will be back to serve you all in the Kirchhoff Center. GV Brew, the coffee shop in the library, will also be open. And Fuel Infusion, we're going to delay the opening just a little bit once we're able to ramp up some of our student staff. We'll get those back open as well. Downtown at our Pew campus, we're going to offer a more traditional dining option with our living learning community starting in the fall in our Plaza Cafe. We'll be open 7 days a week in that location. Starbucks and Herbert and Gerbert and the Seidman Cafe will also be reopened for fall for our downtown students and staff. And as always, we'll follow all health department guidelines as it pertains to food safety and COVID. As we're going into the new academic year, we need many student employees to support our campus dining operations. We'll ramp up to full operational hours and services once we're able to hire more students on campus. I encourage anyone interested in working with us to go to gvsufood.com and hit the Jobs Apply Now button and just apply to come to work with us. You can also apply in person if you're on campus at any dining location. We have flexible schedules. You can earn meals for working, and working with us is a great resume builder as you start your college careers. I encourage everyone to visit the campus dining website for service hours. Remember, hours change during move-in week, the first week of classes, then again for Labor Day. So if you have questions throughout any of your time, please stop in. Our offices are in Lower Commons 100, or you can reach us at extension 3016. We look forward to seeing you all soon. Go Lakers.
Thank you, Paul. You mentioned that, of course, we'll be following all COVID procedures for the university. We're beginning at level 2, which means we're wearing masks. So in our dining facilities, you mentioned, we'll be following protocols. And so students know that they can remove their masks to eat, but are there any other precautions they should know about?
Yeah, currently there are no restrictions or other guidelines. Wear your mask to get into the facility, remove it to dine, and currently no restrictions. So we're kind of back as close to normal as we can get for now. And we'll just keep monitoring that as we progress through the semester.
Thank you. And Kyle, I might ask you again, you mentioned housing and MoveIn will be following these protocols. Anything specific you want to share about that?
Yes, when you get it for MoveIn, first of all, make sure you check your email to kind of understand when you should be showing up for MoveIn. We are taking safety really seriously. So there's a self-assessment that all visitors and students will have to complete before receiving their key that lets us know that you're healthy and ready to move forward in the line. And we also created MoveIn as a very as a staggered approach where we're not having every student or 5,000 students come at one time. We're spreading it throughout the week. So we're keeping safety and keeping safety and being socially distanced in mind as well. So we are really trying to prepare that way. And that's how we're kind of supporting the safety measures that are in place.
Thank you. Doug Lipinski, give us an update on athletics.
Well, we're super excited to have sports back on campus and bring the spirit to campus. We have 7 home football games this year, 3 to start off the seasons. For the first 3 football games will be at home starting Thursday, September 2nd, 7 o'clock. We'll at all of our venues, our outdoor venues will be at full capacity following all our community and safety protocols and guidelines. A few changes that you'll notice at football this year. One, we're going to have with the on-campus cashless initiative, that will be happening at all of our athletic venues as well. So we encourage folks to purchase their parking for football online prior to coming to campus. If you do that, it's $10 for general parking. If you wait till the day of, it's $15. So we do encourage you to purchase prior to. Merchandise, tickets, also concessions will all be cashless at our venues. So please be prepared for that. Speaking of tickets, we've gone to digital ticketing. This will be the first time that we're 100% digital. We've been at about 75% prior to COVID at our football games. We've made that move to all digital. You can print it at home if you want, or have it on your smartphone. We'll go ahead and scan it. And the big change for our students, we've been able to integrate our digital ticketing with their student ID. So now you just show your student ID, we scan at the gate, and you come into our events. So you no longer have to go online to get an athletic ticket if you're a student. Just show your ID. Two other things that we've made changes with. One, we have a new clear bag policy. We believe that's going to help with our bag check line and get folks into the stadium quicker, obviously being socially distant while we do this. And then we have a new sidewalk down to Stadium Drive. If you've ever been to a football game, you know how congested that gets. And with that new sidewalk, it will allow for greater egress down to the stadium. All the information related to game day and your experience for game day, tickets, merchandise, you go to our website, gvsulakers.com. It's all right there for you. We appreciate everybody's support. It's been a long time coming. We are super excited about bringing the spirit to campus, and we're looking for a good season. And as always, anchor up.
Thank you, Doug. President Mantella, I'll turn it over to you for any closing remarks.
Thank you, Dottie, and thank you to the rest of the panelists for all the insight you provided. I'm going to start or end where we began, which is, why are we doing all of this? And that is first and foremost community safety. So the new guidelines will put all of these controls in place, from vaccinations, which don't delay. The FDA approval is coming. We'd love for you to be fully vaccinated by September 30th. The clinics will be all over campus, and the first week, move in. If it's an information gap you haven't told us, tell us now. Let's get our numbers up and our risk down by adhering to the policy for vaccination, for masking, and for testing. And so that's first and foremost. We're all so excited to be able to offer this kind of full experience because we're confident our community will align with the requirements, because you'll understand the why. And the why is about community safety, keeping learning happening, and preserving this full experience for our students. We don't want them to have half of Grand Valley or a quarter of Grand Valley. We want them to have all of Grand Valley State University. And that means relationships and community and safely learning. Second, I would ask you to please keep your eye on the dashboard. Ed brought it up for all of you. It's very thoughtful. There's, I think, 23 different factors that are watched daily. It's integrated, and the risk will be monitored, and the mitigations will be added or subtracted based on the risk that we see. So keep an eye on that, because that's very, very important. Third is, I would say, let's act with care. This is not easy. It's not easy for anyone. This whole situation that we've all been in, the stress people are carrying personally, has not kept us at our best, quite frankly. Let's act with care. Let's act with respect. Let's act civilly. We teach civil discourse in liberal education as our foundation. If we disagree, if we have questions, if people aren't doing the right thing, appreciate where they may be coming from, appreciate the differences of our backgrounds, use education as a tool, get them to the right location, and let's get people in conformance so that we can have a full community experience and we can all be safe and we can be supporting one another. So thank you so much for being with us today. I appreciate the difficulty that this presents for many, many people and the anxiety. And we hope that the conversation today not only helped to add information, but to understand why and to excite you about the opportunities to be together in community in a safe environment. So thank you very much to all of the panelists and to each of you. And if you see a faculty member who's in the classroom, thank them. If you see a student life staff member, thank them. If you see a virus action team member, thank them. How about the essential workers who've been here for all of the 18 months? Thank them. That's who we are. Let's care for each other.
Thank you, President Mantella. Thank you, panelists, and for everyone watching. It was recorded and we will post it on Lakers Together. Thank you.